I found two posters very fascinating. One poster was migraine reduces during pregnancy. So, during pregnancy, migraine will not be there. So, one of the answer is be permanently pregnant. There will be no headache. And the second is divorce make it better. Wow. One side, one is saying that be pregnant and get rid of migraine. One side, get divorced and there is no headache. Are migraine a neurological disorder? Very interesting question. Can migraine cause strokes? How is the migraine different from other headache? Skipping breakfast or meal is one of the major aggravating factors in most of the migraine patients. Why do women feel more pain during menstrual time? Another question, can migraine be cured completely? So if I say hello everyone, we have been successful in establishing proof of efficacy in bringing complete and sustainable relief to the refractory and chronic migraine patient, which still remains a mystery and incurable in modern medicine. And I'm telling it based on a report of a randomized controlled clinical trial which was held at Department of Neurology, All India Medical Institute, New Delhi, where Ayurvedic treatment was found significantly effective. And in fact, in allopathy group, none of the patients showed complete recovery, while in Ayurvedic group, there was more than 20 times patient who showed complete recovery. So that gave us a name. And nowadays, it is the era of social media. So people read about it on different forum. There is a research paper on ResearchGate, Twitters, LinkedIn, Instagram, and question keeps on coming. So I would like to reply these questions of the viewers. The first question, can ginger reduce inflammation and nausea, two common migraine symptoms? Migraine is a symptom of the headache with nausea and vomiting, photophobia and phonophobia. But if you have a disease, there are two points of view. Either you treat the symptom or treat the cause. So treating symptoms, you can use anything. If you feel ginger help you, you take it. But as a Vaidya, I will say neither ginger nor anything else can cure migraine completely, because migraine to me is a reflexes of our gut, is a inflammation, is a physiological changes, functional disorder of our GIT, and for that you need a systematic approach rather than doing tit and bits. Another question comes, lavender oil reduces stress and can ease migraine patient. Yes, any massage, suppose is a vaso instructor, then you use massage, there may be vasodilation. So it's not lavender oil. Maybe it is through normal mustard oil, coconut oil, or ghee massage. So any massage can help you for a while, but it is a temporary remedy. It will not give you permanent relief. Another question is, why migraine causes vomiting and feeling of nausea? Migraine is considered as a neurological supraorbital disorder. And they say that there are few nerves in the nervous system which are affected and they cause nausea. But in our experience, migraine is a rashesha jivna, indigestion. And when it happens, when a patient is suffering with headache, they feel better after releasing the undigested food outside or with the sleep. And when you go for sleep, what you do? Ardha rog hari nidra. Half of the disease can be cured by sleep because you feel better with that. You feel food is digested that time. So there is a great link between the digestion and migraine, and digestion is not due to the food. Digestion is due to the physiological functional changes in our gut. So treat the cause, not the symptoms. One question comes from the acupressure point, that a particular point, if you press or circular form, it helps in reducing the migraine. So there are many measures. There are many measures to reduce the pain. I was in Sweden in the 13th International Headache Congress where I presented my work, and I found two posters very fascinating. One poster was, migraine reduces during pregnancy. So, during pregnancy, migraine will not be there. So, one of the answer is, be permanently pregnant. There will be no headache. And the second is, divorce make it better. Wow. One side, one is saying that be pregnant and get rid of migraine. One side, get divorced and there is no headache. But again, these are not the cause. These are the outer factor, because during pregnancy, a lady eats more, take rest more. So I think, or acceleration, they helps in reducing thing. And second thing, when the divorce is there, so divorce means a stressful life. And when stress is over, migraine frequency and intensity can be less. Similarly, if you have a acupressure point, it will give a symptomatic relief for a while, but the basic cause, why it is coming again and again, it will not be addressed. One question says, if you drink enough water, it helps in reducing the pain. I may agree to that, because ajirne bhejijam vari. If you have indigestion, then take sips of water, and that will help in curing the indigestion. And when indigestion will be better, then migraine intensity and frequency will be better. But again, it is a temporary remedy. You have to fix the functional disorders within your GIT to get complete cure. There is a question, then CoQ10 and this capsicum can help in reducing migraine attacks. So yes, they may stimulate for the body for a while. So there are plenty of things which can do that, which can reduce the frequency, but they will, or intensity, but these are all temporarily tit and bit to reduce the migraine patients. Migraine cannot be cured by them. Another question is, can migraine cause strokes? Not really, because but if somebody is stressed, somebody is not able to sleep, and it is affecting other organs, so it can be outcome. But migraine alone cannot be responsible for the stroke. I have not seen in my life, so maybe the subject experts and who have done more epidemiological studies, they can give the right answer. One question is, what is the difference between sinusitis migraine, tension headache and migraine? These are very clearly defined by International Headache Society, who has made diagnostic criteria for migraine. Migraine basically defined by, based on a interview. There are a few questions. First is frequency of headache. 5 episodes in the year. Minimum 4 hours to 72 hours duration. That means if there is a headache, it should not reduce within 4 hours without taking any treatment, and it should not last more than 72 hours. Similarly, pain characteristic, it should be unilateral or bilateral, both sides or one side. Pulsating in nature, moderate to severe intensity, and aggravation on physical exertion. Out of 4, if 2 are there. And during attack, nausea, vomiting, or photophobia, phonophobia. If it is present and there is no other neurological symptom, then it is called migraine. But if a patient having this symptom and getting up in the sleep, or migraine starts early in the morning, so that is called sinusitis migraine. And tension headache is altogether different, where you will not find these things. So for that, all criteria are available in today's information. You can ask Grok, you can ask Wikipedia, you can ask Google, what is the criteria of migraine, and I think you will get it, because these all diagnoses are based on interviews, and you have to give the answer very smartly for that. Now there is a question, how is the migraine different from other headache? Actually, migraine is a form of headache. So we cannot differentiate. Migraine is a headache, and it is a peculiar thing, and it is said that 90% of headache are migraine. So we cannot say differentiate migraine and headache. Migraine is a particular type of headache which is the more prominent. And out of that, classical migraine without aura, is more common in all migraines. Are migraine a neurological disorder? It's a very interesting question. where I would like to say that in 1783, a Swiss doctor called Dr. Tissot was the one who ascribed migraine first time, and he said that it is a reflexes of gallbladder, stomach and uterus. At that time, the father of Charles Darwin, who was a doctor and British Empire was on supreme, he rejected that theory. And he said migraine is a supraorbital neurological disorder. And since then, West is following that concept. But in our findings, which we have been doing since 1985, I fully endorse the work of Dr. Tissot, because we find migraine is the outcome of the reflexes of the gallbladder and the colon and the digestive system. And to me, it is very difficult to accept that migraine is merely a neurological disorder. Another question, can migraine be cured completely? So if I say, if I have to give answer, I said yes, it is curable. I remember many patients who come, they are in tears when I say, I can cure you. Well, you are the first one who can say you can cure. I'm not saying I can because I have done it and I keep on doing it. So migraine is curable provided you follow the protocol, you follow the diet plan with patients, and it is completely curable. But in modern medicine, it remains incurable because they are not able to establish the cause and cure. Are migraine common in children and teenagers? So migraine is a disease which can affect any. It affects children, teenage, puberty, adults. But by the time you get more and more age, the frequency is less. So it's the disease of everyone. And but the middle age, I say from puberty to menopause or 14 to 50, these are the 19 to 45, adolescent age, crossing adolescent age to the this old age, that comes the maximum, but 19 to 45 is the maximum patient. There is another question, it says, do migraine run in the families? Yes, there are known and published study where it is said that a new migraine patient can come from the close family. This is about 10 to 15%, but this is again curable with Ayurvedic approach. If there is a migraine running in the family, so I say Ayurveda, which is running in my family. My father was a Vaidya, his guru was a Vaidya, and now me and my daughter is a Vaidya. And there are other Ayurvedic doctors across the country who are not my blood relation, but after following the protocol, they are also able to cure migraine successfully. There's another question, does a compressed cold bath combined with fermented hot bath can reduce the migraine patient? So migraine is a thing where vasodilation is there and vasoconstriction is there. So both way when you do, you can affect your circulation and it can give some relief to some of the patient, but it cannot be a remedy for all. And again, it is not a cure. It has again a controlling features. Another question is, does teeth grinding and chewing habits can reduce migraine patients? So definitely some people might have experienced it. And I think there is a reason behind it. When you chew more, when you teeth grinding more, you take more saliva inside and you get more enzymes. It helps in digestion. It might be helping the digestion, and that time patients might be feeling benefit. But it is again not a cure. It is again a symptomatic relief. To some of them, it cannot be a hard and fast rule to all, that if we are doing teeth grinding and we are chewing more, it will help. It can reduce, it can help, or it might not help. There's another question like B12, B1, B6, B12 can help in reducing the migraine patient. So migraine affects our nervous system, and B1, B6, B12 are one of the nutrients for those systems. So some people might have experience if they're deficient to that. But again, it is a temporary relief. It can be a ad hoc or contingency plan, but there is no proof that it can cure migraine. For symptomatic relief, there are numerous things which can help depending on individual to individual experience. Another question is about vitamin D3. Does any deficiency of vitamin D can increase the risk of migraine or aggravate migraine? So vitamin D3 is essential to our body, and it is more towards the fatigue. And if a person is fatigued, or the other underlying cause can aggravate. So, and vitamin D3 is so common nowadays, deficiency is so common that many diseases are coming. So fatigue and migraine goes hand in hand. So vitamin D3 level should be checked and it should be kept under control. There is another question ki folic acid helps in hormone related migraine. Possible, because again it is a nutrient. If you fulfill your body with enough nutrients, you make your own defense system strong, then you can fight with every disease. So it might be possible that while taking all these things, it can reduce the frequency or intensity, but again I will repeat, these are not the cure. These are not the cure. These are just few tips which migraine patients take by themselves. But if you want to get cure, you have to go for the cause and cure theory for migraine. Similarly, there are questions about yoga, yogasana, exercise can reduce migraine. So yes, if you do deep breathing, if you do good stretch exercise, you don't get tired. So these are good to remain healthy. And there are reported cases that if you are regular with your diet, with your lifestyle, with your sleep, with your exercise, so maybe you are able to normalize your body function and that can cure. But in moderate condition, it is possible, because migraine is a disease which is within the body. It doesn't come from outside and is the outcome of body abuse. So when you do yoga, when you do diet, when you do sleep, these things can help you in getting rid of it. But when you add some medicine to that, then it is sone mein suhaga. There are questions about artificial sweeteners, alcohol, about aggravating the factors. So it depends on person to person. Some patient may feel they feel better after taking alcohol. Some patient may say they get aggravated to that. So again, it is individual body. But one question is, does skipping meals aggravate migraine? I will say definitely yes, because the moment you skip the meal, the acid-alkali disbalance get more aggravated, and migraine is the outcome of the disbalance of acid and alkali within the body. So skipping breakfast or meal is one of the major aggravating factors in most of the migraine patient. There is a question, pregnancy makes migraine worse, but what are the reported studies are there? During pregnancy, migraine attack are reduced significantly. So these are the published studies, but pregnancy make it worse, I have not come across. There is another question, why do women feel more pain during menstrual time? So migraine, which has a International Headache Society diagnostic criteria, and when it is coming only during the menses time, that is called menstrual migraine. And during menstruation, ladies release more nutrients from the body. They get stress on the body, that is good. But if they, and that is one of the reasons. But that is also reversible by improving their dietary pattern, nutrition, and rest, etc. Now the question comes, does sun cause migraine? So aggravating factors, if you see of the migraine, exposure to sun, traveling, change of place, weather change, they are all attributed to that, because they affects body metabolism and our functioning. So that are true facts. So going to sun can cause, because again it is a vasodilation and migraine can be out of it. But these are again the immediate cause. In Ayurveda is called Sannikrish Hetu, Viprisht Hetu. Sannikrish Hetu means immediate cause. Viprisht Hetu means dur ka cause, far away, far distance cause. Underlying cause is there, and these are all aggravating factors. So that's why it's there. There is a last question. Okay, does a person has migraine, will his offsprings will have migraine? Not necessary. So one should not be living with the fear of migraine. Migraine will not kill you. It is a bothersome thing. But I am glad that structured Ayurvedic treatment protocol is able to cure for it. Don't worry about it. As long as you are Indian, you live in India, and we have a well-structured treatment protocol to cure migraine, whether it's a genetic or non-genetic. Thank you very much.